In the last video that I made, I was talking about Ehlers-Danlos and how you know if you have Ehlers-Danlos or hypermobility spectrum disorder. And I thought that I would make this video talking mostly about dysautonomia or POTS, postural orthostatic tachycardia syndrome, which is what I was diagnosed with. And just go over the symptoms to look for, or different aspects of this disorder. So I'm just going to be sharing my personal experience with any condition, hypermobility, POTS, mast cell. It's going to be different for every person. You might have some similarities, but there might be some differences as well in terms of what symptoms are the most bothersome or present the most for you. So this is just my personal experience, my personal journey with it, and maybe it will be helpful for somebody to hear. So to start off, POTS or postural orthostatic tachycardia syndrome is a form of dysautonomia. And dysautonomia is a dysregulation in your autonomic nervous system. And your autonomic nervous system is what controls all of the things that you don't really have to think about within your body, like breathing, blood pressure regulation, temperature regulation, digestion, heart rate. All of those things that your body just kind of does naturally is affected when you have dysautonomia. So there can be a lot of different causes for it. It seems like it's making more, it's being more recognized in recent years because of COVID, because people who have experienced long COVID after getting COVID have been diagnosed with POTS because the impact of having COVID has created long-lasting symptoms and things like that for them, which for them is POTS. So it's like long COVID, I think that's just what it's called, but it is POTS. Not all long COVID is POTS. I think that there's other things, too, but a lot of the people who have long COVID have POTS. So it can be triggered by a viral infection like mono, I think even the flu or any kind of viral infection, really. Anything that overwhelms your nervous system can cause it. It's more prevalent in women than it is in men, and it tends to also occur after puberty and after childbirth for women. It can happen after things like a car accident that was really severe that made it hard for your body to kind of recover. And also any sort of really large emotional or mental stressor or trigger can cause POTS or dysautonomia. Pretty much anything that leaves you in a state of fight or flight can also cause it. It is comorbid with other conditions. It is very commonly comorbid with conditions like Ehlers-Danlos or hypermobility, mast cell activation disorder. It's, I think, also common to be comorbid with certain types of autoimmune conditions and cancer. And I think that it is also, I lost my train of thought, but it also is comorbid with other conditions, basically. So you can develop this really at any point in your life. Even if you were previously somewhat healthy, you can suddenly develop it. My mom was diagnosed with mitochondrial disease. That's another common one that is comorbid with POTS. And so some of the symptoms that you might experience if you have POTS is, upon standing, your heart rate goes from a baseline of, where it's at when you're laying down, somewhere in the 60s or 70s typically, to when you sit or stand, it elevates by 30 beats or more. And that's, I think, ultimately the main diagnostic criteria is when you go from laying down to standing, your heart rate increases by 30 beats or more per minute. And it is something that affects so many different parts of your body. It can impact your digestion. For me, how it shows up in my body is kind of hard to distinguish sometimes because a lot of the symptoms from mast cell and a lot of the symptoms from dysautonomia overlap with one another. So at times it's really hard for me to pinpoint which condition is affecting me at what time. But it can cause temperature dysregulation. So I often will experience my baseline temperature runs pretty low. So I'm usually around like 97, between 97.2 and 97.6 degrees normally in my body temperature. So if I am in an environment where I am cold, my temperature will go low pretty quickly. I've had to go to like 95.2, 95.3 and felt pretty symptomatic. There was nothing I could really do to warm myself up very quickly. It was pretty scary. So on the flip side, in the summer, I have heat intolerance where I cannot be in very humid environments or very warm environments for long at all before I just feel like I'm going to pass out. I don't feel good. My heart is racing. I feel like my blood pooling in my body. It's really overwhelming. And so for a lot of people with POTS, the heat really gets to them. I think for me, the heat is worse than the cold because I can kind of prepare myself in colder weather. I can, wear a lot of layers or things like that. But in the summer, it's hard because there's only so much you can do to try to cool down. So the summers for me are pretty exhausting and pretty intense. There's other symptoms as well, like chronic digestive issues, which can be severe. For me, they are very severe. I typically experience chronic constipation, which I have ever since I can remember. But I will at times swing the other way rapidly into diarrhea. And there's no in between. There's no typically I have to take a laxative every single day just to have my digestive system function and for me to be able to go to the bathroom. And so in those episodes where I go from severe constipation into diarrhea, a simple solution for most people would be, well, don't take the laxative during that time. But for me, it's not so simple because if I were to not do that, I wouldn't go into a normal kind of a mode, or it's not just that the diarrhea would stop, it would go into such severe constipation that I would be at risk of a bowel obstruction. I would be at risk of impaction and just horrendous pain to the point where it would send me to the emergency room because it would go straight into that severe of constipation. So it causes extreme dysfunction in that regard. And I share this because I know that I'm not the only person out here who has these issues and, who is dealing with these things. And like I said in my previous videos, this has been a very, very long, hard journey and hard trifecta, I guess, of illnesses to live with and navigate. And just wanting to let other people know, if this is you too, you're not alone. So throughout my life, when I would go to the doctors, I would frequently think I had anxiety. I was told throughout my life, I have anxiety. Here's an antidepressant. Here's anti-anxiety medication. And, you have anxiety, basically. So it was never looked into more than that. Nobody ever stopped to say why, bodily wise, is there something that could potentially be causing her to have anxiety in this kind of a way? And it was just kind of assumed, well, it's just anxiety, it's like a typical experience, I guess, for your average person in some regard. So they just send you out the door with some antidepressants and anti-anxiety medication, and you just carry on, I guess. And so that is pretty much what I did for most of my life, I would say, into my mid 20s. And that's when it started to really affect me more than just anxiety. Like, I knew my body just wasn't functioning the way that it was supposed to be. So I would say that the first instances that I realized that something wasn't quite right was probably when I was around 26 years old. And I started to have a lot of symptoms of, like, I would say mast cell symptoms, where I felt like my throat was closing often, just a lot of tightness in my throat, but that's for the mast cell portion. I felt like a lot of nausea, which can be caused by both mast cell and the dysautonomia. So I felt that, and I felt at times heart pain and like palpitations within my heart. I felt fatigue to the point where I could go and do things. I would be able to go for walks and be active, but I had to rest afterwards more than other people did. So, like, if I went for a walk or I went and I did something which I enjoyed doing often, pretty much daily, I noticed that if I was with somebody else, they could kind of carry on with their day and just continue doing things, whereas I would have to lay down and rest for a long time afterwards. Sometimes for 2 to 3 days before I could get up and go and do it again, depending on how much I did. But I still was able to be pretty active at that time. I would say in my late 20s, I experienced a lot of emotional overwhelm from situations in my life. I wouldn't nowhere near say that it was the most severe that I've ever experienced. And I've experienced way more and way worse than what I was experiencing at that particular time. But for some reason, I think it all just kind of caught up to me and was um, overriding my nervous system, and was kind of like a breaking point for me. So I started to notice more symptoms, like I would be driving and have to pull over and lay down for a little bit because I would get really dizzy and feel like I was going to pass out. If I went to go and eat, go out to eat for lunch or something, or dinner with my friends, and we would go to a restaurant, I would have to ask if we all took like one car and went together, I would have to ask them for their keys so that I could go lay down in the back of their car while they had their food come to them and like sit down and eat and all of that, because I was so sick and I felt like I was going to pass out. If I was with, um, people and we were out at like a water park or something like that, and it was summer and it was really hot, and I was out in the heat for a while, I would start to feel really dizzy, feel like I was going to pass out. I would have to go and lay down somewhere. I started to notice a lot of symptoms like that. And again, was just told, hey, it's anxiety. Like, that's your problem. It didn't feel like anxiety to me. It didn't, I knew what anxiety felt like because I had episodes of panic attacks in my life when I was younger. And I remember the feeling of like impending doom and stuff like that. This wasn't so much like that. This was more of, I'm going to pass out. Like, I need to lay down for some reason, because when I lay down, it relieves my symptoms and I can kind of regulate myself. And so that's what I was experiencing mostly. And I started to notice I had more fatigue. So the fatigue was increasing, and I started to not be able to keep up with a lot of the things that I was used to doing. I needed to take longer times to recover from doing things that I used to do that I didn't have to take that long recovering from. And on the outside, I looked very well. I looked very healthy and normal, and I actually looked like I was in very good health. And I will share some photos of myself like around this time and kind of at the start of and in between flares to show that, outwardly I appeared to be normal. And then I will share like behind the scenes, like in between these times, what reality really was like, so that it's kind of understood, like you can't really tell by looking at somebody how sick they actually are. So um, there is um, also a pretty high connection between neurodivergence and POTS for some reason, as I mentioned in the video about Ehlers-Danlos, how it is surprisingly something that seems to be pretty common among people who are ADHD or who have autism. POTS is one of these conditions too that is often found in neurodivergent people. And I think, like I said, I think that it has something to do with the world not really being built for us to navigate in the same way that it is for neurotypicals. It is more intense. We take in things a little bit more intensely. And I think that it puts our nervous system in a constant state of fight or flight. And running at that high of like adrenaline all the time to try to just keep up with everything really dysregulates the nervous system. And I think that, it is important to recognize there is no cure for POTS. There's no cure for dysautonomia. I have seen many videos where people have been able to put it into remission and be able to find things that have really worked for them and help them. The only things that you can really do with this condition is to get some compression socks or some compression leggings to help your blood to not pool in your feet, because one of the main things that happens with this condition is that the blood that is supposed to circulate throughout your body and return to your brain cannot get there. And so it all kind of just sits at the bottom of your body. A lot of the time, a symptom of this condition will be that your feet get very red or hot, or purple, because the blood is just pooling there and it cannot return to your brain. The way that I think that this is kind of connected to Ehlers-Danlos is because our vessels lack the collagen. It just cannot constrict and help it to, circulate the way that it needs to. But we will experience a lot of brain fog, a lot of like concentration problems, focus problems, and that is where passing out actually comes from the lack of like oxygen and blood flow back up to the brain. So compression socks and compression leggings help to push that back up to where it should be. It is recommended to add extra salt to your diet. Most of the time you hear salt isn't a good thing, or, you shouldn't really have that much salt. But in this condition, you actually have to have extra salt than the average person would get. So I was told, I think it was like 1 or 2 extra teaspoons at least a day. And to try to make sure that you're eating foods that have a high sodium content in them. And then to drink a lot of water. And when I say a lot of water, I mean to the point where you're on the verge of being like overhydrated, because you need that much water with this condition. And what that does is it helps to increase the blood volume within your body, and the sodium helps to retain it and hydrate you a little bit better. I have found that a lot of the time when I'm in a very bad flare up and I just can't keep up with everything, I have to go in to have actual IV fluids. And that helps me to feel a little bit better sometimes. And I just feel like it gets in me faster. It goes through my body faster. So that is something that it is helpful for me when that happens. So aside from that, if you have really high heart rates, like the last time that I went to the doctors, I have to go like every, I think like 6 months to have it kind of monitored. And when my blood pressure and my heart rate were checked, I was told like your heart rate can't be that high all the time, and you have to go on a beta blocker. Basically, I think it's called like metoprolol or something. Metoprolol. I don't know how you pronounce it, but there are different forms of beta blockers that you can try, and so I was prescribed that, but I'm very thankful that I did not take that, because unfortunately I don't just experience tachycardia. I also experience bradycardia, where my heart rate, instead of going abnormally high, will also swing and go abnormally low. So that's just an example of like the autonomic dysfunction where your body cannot figure out how to regulate itself. And if I would have taken that beta blocker to bring my heart rate down, when my heart rate goes into like the 50s or like 49, 48, I don't even want to know where it would have went. So I'm glad that I kind of listened to my body intuitively and did not start that. But for a lot of people that don't have those episodes where their heart rate goes low and they just are sitting at like continual high heart rates, that can be helpful, I think, sometimes to help the heart rate to come down. And other than that, though, there isn't anything else that you can do for this condition. It's very sad because I think that most of the time you're just expected to carry on like, everybody else does, but you can't function at the same capacity as other people who don't have this condition can. And it can be really frustrating. But the biggest thing that's frustrating, or has been frustrating to me at least, has been the ways that I have felt neglected in the healthcare system, in a sense, where it wasn't until it was so severe, like my symptoms were so severe, that they even considered trying to figure out what was wrong. Before that, it was just always anxiety. And I think, unfortunately, for women, it is a little bit worse, because when we go in with any sort of complaint like this, like our heart is racing, or we have fatigue, or we have brain fog, or our digestion is kind of weird and we're having these really debilitating symptoms, it's just, oh, here's this, you're depressed or you have anxiety. And for me, that was the most frustrating part, especially when I was in a flare-up. So the first really significant flare-up that I had was at the same time that I was able to discover I had hypermobility, which would have been in 2022. And I was working at an assisted living facility. So I was talking a little bit about that in my hypermobile video. But the ways that POTS presented itself at this time was I was noticing that when I would bend over to do anything, my heart would just hurt. It was like an ache, like a deep ache within my heart. And I felt like my heart rate was just going through the roof like all the time. There was nothing that I could do to really help it. I never experienced it to that degree before, so I went to the urgent care, and urgent care told me next time I needed to go to the ER. They hooked me up to a machine and checked my heart rate. Everything was normal, everything was fine. They gave me a medicine for an antacid because they thought maybe it was acid reflux, and they sent me on my way. And a couple days later, I tried to just push through it and ended up worse. So I ended up in the emergency room. And They monitored me. I was in constant tachycardia the whole time that I was there. I was concerned maybe I was low in like electrolytes or something. That was all fine. There really wasn't anything like that. I had stopped at Taco Bell before, and I was concerned that maybe I had too much sodium, that maybe that's what was causing it. But surprisingly, no, my sodium was fine. Um, and that wasn't the cause of it. Um, and so I was just told, to just take it easy pretty much and rest a little bit. A few days later, it was even worse. My tachycardia was like 130 at that point, just sitting. And so I went back in again, hooked up to machines again. And they even tried to give me Ativan through my IV, thinking that it was anxiety, thinking that that was going to bring my heart rate down. And it didn't. My heart rate was in the 150s at that point. And still, I was told, maybe you should go to therapy. Maybe this is anxiety. And, I think it would be good for you to talk to somebody. And mind you, I have been in therapy pretty much my entire life. So therapy was not like something that I needed to do because I was doing that. Um, so I was like, I knew intuitively that's not it. But I just was feeling overwhelmed and frustrated and went home. I could not move from my couch. I could not stand in the shower to wash my hair. I could not stand to cook food. I could not drive. I couldn't do laundry. I couldn't do anything for 3 months. I was bedridden for 3 months. Um, when I did start to recover and I did start to come out of that really bad flare up, I was able to go to stores and use like the motorized scooters around, because if I tried to walk, it would exhaust me and like kick my symptoms back up. So I had to try to remain seated as much as possible or laying down. And it took me a while to fully recover. But I went to the doctor around that time as well. And I remember my doctor looking at me and he was like, "Are you short of breath right now?" And I was like, "Yeah." And he was like, "I think that you have POTS, but look it up and let me know what you think." And I have a friend that's a nurse, and I mentioned it to her, and she said, "Yeah, I think that that is what you have too." So I looked it up, and I was pretty sure that that's what I had, but I wasn't entirely sure. It took 2 years to get into a specialist to be seen for the symptoms that I was having. So in the meantime, I just hoped I didn't die. I hoped that that was what it was and that I was going to be okay, but I didn't feel like I was going to be okay. I felt like and it wasn't the kind of like feeling like you're going to die like anxiety. It was like feeling like you're going to die because something's wrong with your heart, something's wrong with your body. And so I wanted to share this because if somebody else, is having these symptoms and is experiencing this, and you just know that it's not anxiety, that it is something more, a way that you can maybe check to see is to get a heart rate monitor. Sometimes they're like a pulse oximeter, that's what I have, and put it on and lay down and kind of get a good idea of where your baseline heart rate is, and then stand up and stay in one spot and stand for a few minutes and see where your heart rate goes and how high it goes. And if it goes over 100 beats and keeps rising and, goes above 30 beats from where you were laying down, you should advocate for yourself and ask to be evaluated for POTS if it is possible and if you can. When I was finally able to get to the specialist that diagnosed me, I had to wait even longer because the testing availability was even prolonged. So it took about like 6 months after seeing the specialist to actually be able to have the tilt table test that I needed. And that's the test that they use to diagnose POTS. So at that point, it was probably around like 2.5 years after my symptoms had occurred. And I went to my appointment. They strap you onto a table and they attach blood pressure cuffs everywhere on you, like your wrist, your arm, on both sides. They test your breathing to see like where your breathing is at. And then they will stand the table up so that they can monitor what your heart rate does and what your blood pressure does. And you're supposed to try to remain standing for as long as you can, or until you pass out, to see, where your levels go. I could not remain up the entire time. I asked to be laid back down, because I was getting pretty close to passing out. It just didn't feel good at all. And after that study was done, I was told I was diagnosed with POTS. And so that is how I found the answer to what I was dealing with at that time. And I just thought that I would share a little bit about it and what it feels like, and the symptoms and the management of it and all of that, and a little bit of my story about it. There's probably a lot, like the video that I made with Ehlers-Danlos and all of that. I know that there's a lot that I left out. There's a lot that I thought about after I made that video, but I'm not going to go back and like edit it or anything. Maybe I'll talk about those things some other time, but I just thought that I would kind of, share a little bit about what it was like for me with this particular condition, in hopes that it helps somebody else. So that's it for this one.